Hello everyone. So today I was having an Oreo biscuit early in the morning with my tea, and then a random thought came to my mind. Why not discuss certain Oreo cookies in radiology? Come on with me. So two Oreo cookies have been described. Number one is in respect to the heart, which is the Oreo cookie sign, which we see in a lateral X-ray or an axial CT. And number two is in respect to the glenoid labrum, which is an MRI finding. And the name here is a double Oreo cookie sign. Let's find out more. Let's talk about the Oreo cookie sign that we see in the heart in the lateral chest X-ray and the axial CT. This is actually seen in a condition where there is fluid collection within the pericardial sac with pericardial effusion. We know that fluid and fat, which is more dense, which is less dense. We know that fat is less dense, that is, it appears darker, and fluid is more dense, it appears whiter. So in Oreo, the cream is white, the biscuits are brown. Similarly, in the Oreo cookie sign that we see here, the fluid represents the middle cream and there are two fats. One is the epicardial fat, another is the pericardial fats. On either side, they form the two darker biscuits. So here in the lateral X-ray, in a pericardial effusion, we have three layers. Number one, here is the fluid. Similarly, here is the fluid, and this blue hypodense thing here is the pericardial fat. Similarly, this fat is the pericardial fat, and here this fat is the epicardial fat. So we have three layers as we have seen. The middle, increased density pericardial fluid, just like the cream of the Oreo, and on either side we have one, the epicardial fat, and two, the pericardial fat, the two biscuits. Let's move on to the double Oreo cookie sign that we see in an MRI of the shoulder with respect to the glenoid labrum in a lesion called the slap tear, which is superior labral anterior posterior tear. Here is an image showing the same, and this is the labrum of the glenoid, and in the superior portion of the glenoid there is an anterior tear. See, there is this tear here. This is a slap lesion. What actually is the double Oreo cookie sign here? In MRI, you will see two hyperintensities in this condition. The more lateral, if I zoom the image, there are two hyperintensities, this and this. The more lateral hyperintensity is actually the slap tear, and this one is a normal sublabral recess fluid collection, which is physiological. Okay, let me remove this. So we have two hyperintense lines. Number one, which is the fluid because of the slap tear, and number two is a physiological fluid in the sublabral recess. So here is the double Oreo cookie. We have layer 1 a labrum, layer 2 labrum, and between the two labrum we have the slap tears fluid, which is the first hyperintensity. This is one biscuit of Oreo. The next is again the labrum, which is darker. The cream in between, the hyperintense line in between, which is the sublabral recess fluid, and then again the biscuit, the glenoid cortex. This is the double Oreo cookie sign that we see in a slap tear of the glenoid labrum. Okay, thank you. I hope you enjoyed it. Bye bye.